Types of weight perception, body mass index intervals between them, alexithymia, anxiety, and depression. De Oliveira Regina, Human Being Rehabilitation Department. Obesity has been associated with less than 6 hours of sleeping duration and more than 8 hours. Prediabetes or metabolic syndrome is linked with obesity and factors such as sedentary and inadequate eating habits, and side effects of drugs for asthma, bronchitis, anxiety, depression, and others. Phthalatus, benzoatus, and bisphenol A has been linked with obesity too. It is a cross-sectional study. The sample was composed by 200 patients with metabolic syndrome from outpatient ambulatory at Unicamp. 126 completed all items studied here. Closed questionnaire were applied, and task 26, back depression and anxiety inventories. Results: actual BMI equal to declared BMI only if there was less sleep interruption, 1 time per night. The differential between types of weight perception occurred in BMI I and BMI III patients who informed sleep interruption more than 2 or 3 times per night if declared BMI was major or minor than real BMI. Anxiety was slight between patients who perceived their weight actual major than declared in positive 21 units of BMI. Anxiety was severe amongst patients who perceived actual weight minor than declared weight. In negative 21 units of BMI. It was non-statistically significant. The more controlled risk factors were, the lesser unsatisfied with their obesity. Between actual weight equal to declared weight, major or equal to negative 5 units of BMI difference to minor or equal positive 5 units of BMI difference. The level of depression in the sample was prevalently slight. More dissatisfaction with own weight were in different intervals of BMI units of difference. Major or equal to negative 11 BMI units of difference, minor or equal, negative 20 units of BMI differences, and major or equal, negative 21 units of BMI intervals of difference, mainly between actual, minor than declared weight. They have prevalently type 2 diabetes mellitus non-controlled. The more satisfied weight beside major or equal negative 5 BMI units of intervals, minor than or equal than positive 5 BMI intervals of difference, where major or equal positive 11, minor or equal positive 20 BMI intervals of difference, mainly between actual, major than declared weight perception. 50% with type 2 diabetes mellitus with higher A1C and LDL. Pure alexithymia was linked only with major or equal positive 21 BMI interval units of difference, mainly between actual, major than declared weight perception, in which type 2 diabetes mellitus were prevalent and presented only hypertension non-controlled. Even though only one risk factor were non-controlled, alexithymia could be a part of this factor, probably primary or structural. Other BMI intervals were linked with associated alexithymia, with depression and or anxiety. It was in agreement with literature in general about obesity and alexithymia. Conclusion. Less sleep interruptions were associated with more precise weight perception, even though there were high A1C and hypertension as risk factors present. Anxiety was severely elevated in actual weight minor than declared weight when the difference was major or equal negative 21 BMI units, mainly between patients who have BMI I related to 2 or 3 sleep interruptions.